I'm Steve Chilton. I'm the Director of IT Services for University Hospital Birmingham. UHB serves a population of approximately 1 million people through 7,000 whole-time equivalent staff. In my role as a Director of IT and with my department, we very much look at how we can serve and underpin the specific needs within the organisation, i.e. our clinical colleagues who are at the coalface of patient care, and those individuals within the organisation have a responsibility around driving organisational performance. What we try to do is listen to those needs within the organisation, understand how we can bring a technology and an ICT layer to those individuals to actually help them in their day-to-day job. What we recognise is there's a growing aspiration for people to be able to get live information on a device that they can carry with them anywhere. And through toolkits such as the Webalo framework, we've been able to actually champion some capabilities within the organisation and actually deliver a live integration to dashboards and applications that we can put into our hands of our junior doctors, our nurses and our clinical staff, as well as the executives who have a responsibility around the performance monitoring of the organisation. Not only can we integrate our mobile phones into our Trust switchboard and into our Wi-Fi network, we can actually dial those individuals just using a simple extension number. In terms of making an investment in yet another toolkit for my development team, I wanted to avoid the cost and the complexity often associated with that investment. And not only that cost and investment, but also avoid some of the pitfalls in terms of having to reinvest in skills and competency development. What I recognised with Webalo is I could avoid all of those pitfalls. Not only was it affordable, but I recognised there was a toolkit that I could give directly to my team and very rapidly deliver applications that were fully functional and usable by people within our organisation. Fundamentally remove the complexity for me, which meant I can deliver more of my work programme because I can deliver a greater volume of applications. Webalo eliminates the coding time and the cost and the complexity associated with traditional development frameworks. What we actually found through Webalo was that the first time we got our hands on it, my application team were delivering me an application within half an hour. For me, one of the golden assets about the software is it gave me the ability to give to my software team a tool set that allowed them to rapidly transform applications and deliver them to handsets. For all the years of looking, we've not really found anything of a similar nature, which for me has made Webalo stand out. It's raised eyebrows for me in terms of how I can get greater productivity out of my team and actually fulfill a greater level of our work programme. The two that we often focus on is the first one, which is called Norse, which is our neurological on-call referral system, for which we've won 1 or 2 awards. And it's an application we built for our neurological team. It provides specialist advice and guidance to other organisations outside of UHB. Typically, their issues prior to the Webalo application being given to those people was that they had to be near a phone to be able to speak to individuals to give them that advice and guidance. With the Webalo application, we provided them the ability to be fundamentally geographically anywhere. And through their BlackBerry smartphone, we could give them access to live information that enables them to give discreet, direct, pertinent advice to organisations outside of UHB in relation to the care and treatment for that particular individual. And also, as they record that information, that data is captured and stored as part of our electronic patient record. The other application that's created some interest for us is called POCS. It's our pharmacy on-call system. And what it's designed to do is actually supplement our pharmacy team. Pharmacists can now fulfil prescriptions from one of the 86,000 drugs and medicines that we hold within UHB. They can do that from their smartphones, irrespective of the geographical location within the organisation. It enables them to take queries from any of the clinical staff within the organisation to help them make an appropriate choice in terms of the medicines they may want to give to a particular patient who's got some particular difficulties or concerns. It all began with a simple trial. My development team took the Webalo toolkit and not within days, not within weeks, not within months, but a matter of hours, handed to me a fully functional application that was integrated to a live system. I know it sounds crazy, but we recognise that the development time is significantly curtailed to the point where I'd say it's 100 times faster. within our organisation, we've got circa 500 consultants who use a BlackBerry smartphone. That BlackBerry smartphone has Webalo on there. On Webalo, we'll provide them a number of applications depending on what their specific role is within the organisation. And we're actually putting power back into those clinical teams who are actually at the coalface treating patients. And I wouldn't hesitate in recommending it to any of my NHS colleagues.